So something that I use to help hold my pump when I'm taking a shower is just this little basket here. It suctions to the shower, so it helps hold it. It can also suction if you have a glass shower. It can suction to the side. That way you can keep your pump away from the water so it doesn't get any sort of damage. And these types of baskets, they work for any type sized pump. So if you're not at home and you don't have your shower basket with you, that's either suction to your wall, suction to the door of your shower, I always use a plastic bag. It can be a bag from anywhere. I take this with me when I go to hotels, go to vacations, go to someone's house that doesn't have my basket, or a place that I can put my pump that is away from the water. So something else that I use when I shower is for around my Broviac. And what I use is cling wrap. I just take a little sheet of it, tear it off, wrap it around my Broviac, and that keeps it, airtight and away from any sort of water getting into my Broviac. And that's something also that I take with me when I travel. They make it in really small boxes that are more travel accessible. And then I also carry with me an enlarged box that I use here at home every time I shower, just to kind of make sure that my Broviac is safe and not near any sort of water to cause any damage. So this is the type of cling wrap I'm talking about. It just simply sticks together. A lot of times people use this to cover up dishes, to conceal it, to keep it longer and to keep it safe. I use it for my Broviac, and so it just sticks together. It makes it nice and tight. That way in the shower, the water just kind of runs right off and it's water resistant.
Remodulin treprostinil injection. Indication, or what is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver or kidney problems. Your Remodulin dose may need to be adjusted if you have liver problems. Have low blood pressure or bleeding problems. Are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure. Symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-877-UNITHER, 1-877-864-8437.